Welcome everyone to this month's Heart Bunch video brought to you by Utah State University Extension's Health Extension Advocacy Research and Teaching Initiative, or as we are sometimes called, the Heart Initiative. We're calling this segment today a Heart to Heart, where Heart faculty interview a guest about a specific topic. My name is Ashley, and I'm joined here by Tim, my colleague, and our guest, Chad Wilkins. We're going to be talking today about National Take Back Day, which is actually the month of April and October each year. And I wanted to welcome and thank you for joining us to talk about this topic, Chad.
Yeah,
And I
I'm
wanted to
happy
start, great. And I wanted to start out with a question for Chad. Please tell us about yourself and your background, including your experience with Take Back Day, professional or otherwise.
Okay. Uh, Hello, I'm Chad Wilkins with the Utah National Guard Counter Drug Program. I currently serve as the program manager for our drug demand reduction and outreach team. It's a mouthful, so you'll have to forgive me if I just go back to the acronym of DDRO throughout this interview. But basically what that is I help run the trainings and events that the DDRO team helps coordinate and do throughout the year and throughout the state. And so that's my job here at Counter Drug. I was put in that position in about 2021, and I've been serving in that position and that capacity since then, and been working to grow the program and grow our SPAR across the state. As far as working with Take Back Day, that was kind of the big projects that I had to take on when I first came onto the program. And so it is a biannual event, and we work very closely with the DEA and local coalitions throughout the state, so that way that we can help them better partner with their law enforcement agencies there at the local level to put on successful Take Back Day programs.
That's great. Thank you for that introduction. We appreciate you being with us today. Could you just explain a little more to us about what exactly Take Back Day is?
Certainly. Yes, so Take Back Day is a biennial event put on by the Drug Enforcement Administration, or the DEA. And so the purpose of that and what it's meant to do is to provide a safe way and areas for local community residents to be able to come in and drop off any unused, unwanted, or unneeded prescription medications without any repercussions. And so completely anonymous, they're able to drop these substances off with their local law enforcement. And it can be held throughout the year, but it's just twice a year in April and October that it is considered a national event where the DEA will actually collect these substances also from the law enforcement agency that for any that they've collected throughout the year as well. And they will take those substances and take them to a destruction facility where they'll be either burned, destroyed, or neutralized in a safe manner, so that way it doesn't end up in our environments, our local communities, in the hands of those that it could potentially harm. And so it's a very safe way and a good way for our law enforcement, our community partners to really kind of integrate and interact with the local populations and do some good by getting rid of unused prescriptions, because Utah and the United States, for that matter, has had a problem with overprescribing medications, just because we don't know how long, someone's pain might last. And so it's been a problem that has had to been dealt with. And so this is one way that we're able to kind of give back and take back those substances, so that way it doesn't get in the wrong hands.
I like that, give back and take back. That's perfect. And you mentioned it's a national event, but what is the importance of this national event twice a year?
Yeah, so the importance is it's meant to keep our communities healthier and safer by reducing the amount of prescriptions or other substances within our communities. I mean, in 2019 alone, we had over 16 million Americans misuse medications, and they obtained them from family members because those family members had more than what was needed in their medicine cabinets. In Utah alone, we had over, I think it was 62%, if I remember correctly, of people prescribed opiates back in 2020. And so, that's astronomically high. So there's a lot of substances and opiates that are out there, medications that are out there. And if they're not handled properly, disposed of properly, it can get into our environment and cause problems with water, with farming, get into the hands of people who don't know how to properly handle those medications. And, they could potentially overdose or harm themselves because they're taking prescriptions that aren't meant for them, or they give it to somebody where they might be allergic to those substances and cause even worse harm or damage. So it's super important just because of the sheer amount of medication that's out there, that we get rid of it safely. And so that's one of the big importances of it, I think. Plus, I think it's really important for especially the adult population to, return these substances, especially if they don't need them, because our youth, they're the future of America. They don't know, they may not know the full side effects of what these substances might do, especially if they're not aware of the prescribing methods or if it's not prescribed for them as well. So super important to keep them safe as well as our communities and environment overall safe.
That's great. What can we drop off? And then maybe the second part of that is, and what are some surprising things that can be dropped off?
Yeah, so you can drop off any unused, unwanted, expired medications, whether it be stuff prescribed by a doctor or over-the-counter cough syrup that you're not using anymore or it's expired. I mean, even prescriptions or medications for your pets that you don't need anymore. You can turn that all in. So, liquids, pills, everything like that. As long as you take off any identifiable information like your name and stuff like that, whether you're just blacking it out or taking off the ID tag from the bottle or you're putting it in a Ziploc bag and giving it to officers, you can give it anything. As far as things that you can't drop off, we can't take anything with batteries. So even though you can turn in vapes and vape cartridges, if it has the battery still installed, they can't take that because that'll cause some problems at the destruction facility, and they're concerned about officer safety at those facilities. And then same thing with sharps. If you're this year we're doing something new in partnership with the Utah Syringe Services Program, where we're providing sharps containers to various events that request them. So if your event has that, you can totally bring in sharps and needles and put them in those sharps containers and have those disposed of properly. But on the catch side, if the site that you're going to drop off medications doesn't have that, they cannot accept your sharps. So it's kind of a dual-edged sword. So you have to be aware of which location has what capabilities for taking items.
Yeah, that's great, Chad. And I think a lot of people don't know that you can take vape devices back just without the battery. So that's great to know what can't be dropped off too. And I think our next question that you could tell us a little more about is the background of law enforcement collaboration with these events throughout the state.
Yeah, definitely. So, I'll kind of start from the top and bring it down to the local level. So this is a national event put on by the DEA. And so their main focus is to reduce substance use in communities, reduce the availability of it. And so their job is to really push out those regulations and guidelines to the local level law enforcement. And so through this event, what they do is they work with law enforcement that get signed up. So that way they're tracking that they are going to be receiving substances from these local law enforcement agencies. But then they're also to give them additional resources like, boxes, trash bags, signage, a bunch of different items that could help these law enforcement agencies put on an event. And then the local law enforcement is then the ones that are they're at the event, they're interacting with the populace, they're handling those substances because of the nature of their job, they're allowed to. And then also a big push that we do here in Utah and in other states as well is that we bring out like local coalitions or community groups that help advertise and also interact and provide additional resources to these people dropping off substances while law enforcement is safely handling those substances. And so really they're there to properly handle it as well as take it to the correct people to dispose of properly and make sure that it's not being stolen after it's been turned in. And so that's really kind of their big portion within these events is they're there to handle it and make sure it gets to where it needs to go to be disposed of properly and safely.
Yeah, very good. Yeah, it's amazing what can be done when you work together, right? So some good things happening when people are doing things together. Now, I guess one of the questions we always ask are, if I miss this opportunity to take my medications or drugs back and drop them off, where else can I do that?
Yeah, so it depends on which community that you're in. Some communities have a lot of permanent Dropbox locations, which you can find through the DEA's website, dea.gov/takebackday. They'll give you a permanent Dropbox locator as well as a Take Back Day event locator. So if you're curious of where it is on the day of, you can find where the nearest one will be to you. And then there's also the Know Your Script that has those locators and links to those permanent Dropbox locations as well. You'll usually find them in your local law enforcement agency office, and you might be lucky to find some in like a Walgreens or a CVS if they've been able to get their regulations in line with the DEA's for that. But there's plenty of ways, especially if you go to the Take Back Day website or Know Your Script, to find those locators and just plug in your address or your zip code, and it'll give you a list of the nearest ones.
Perfect. Yeah, and people can do that all year round. These take back days are just a highlight to go through your medicine cabinet twice a year, right?
Yeah.
Yeah, and
Yeah. Oh,
oh,
go ahead.
Chad.
Sorry.
No, go ahead.
I was going to say, yeah, the other option is, like the DEA said, these take back days can be held all throughout the year. With law enforcement, they can hold an event in the middle of summer. They just have to hold on to those collected prescriptions until the national day where they can turn them back into the DEA. So that's another option if, say, you don't have a permanent Dropbox location, your local law enforcement can put on another take back day at any time during the year.
Oh, awesome. That's great to know. And this last question for you is, where can we learn more, or is there anything else that we didn't talk about that you would like to share?
Yeah, so to learn more about Take Back Day in general, I would just go to their Take Back Day website, which again is that dea.gov/takebackday. And that will give you resources and posters as well as the yearly amounts that they've collected in the previous years, why they're putting it on it more in depth, the data behind that, as well as links to some of their other campaigns like One Pill Can Kill and some other anti-drug information on that. You can also go to Know Your Script. That really pushes the importance of taking the medications that are meant for you and not taking someone else's, knowing how to take them properly, knowing that you need to dispose of them properly through take back days or these Dropbox locations, and how to talk with your family about substances there as well, and how they impact your health. And so I would heavily recommend the dea.gov/takebackday website and the knowyourscript.org website for more information on it.
Wonderful. Thank you so much for joining us this time to talk about this. Tim, do you have any other questions for Chad?
I just wanted to thank him very much for doing this and for doing all that good work, doing this Take Back Day coming up. It'll be very exciting. Hopefully things can get dropped off, and so we do have a safer environment for our families, our children, and everyone. So again, we appreciate you doing this and wish you the best.
Yeah, my pleasure. Thank you guys both again for inviting me to come on and talk about Take Back Day. It's an awesome program, and we're really passionate about it over at the Guard.
Thank you, Chad.